THI was recently honored by Yashraj Bharati Samman for innovation in healthcare that created a lasting impact for the tribals of Sitligi. We had the opportunity to hear all about THI's journey from Dr. Reji himself.
So when we came here and we started work in 1993, our first goal was actually to tackle maternal mortality, mothers dying in childbirth as well as child survival. And we had decided that hospitals alone cannot tackle this problem. And we had to think differently. Therefore, we started training tribal mothers and tribal girls in healthcare. But after 10 years, we realized that even that is not enough. Unless we start thinking about good food, farming, livelihoods, watersheds, good health will not come. And therefore, we had to innovate. And during this process of innovation, we realized that we were doctors and we knew nothing about all these things, about food or farming or livelihoods. And we took the trouble of going outside and learning about these things and coming back to these communities and trying to get them to change their habits and change their ways of living. And what we found is that once you innovate and once doctors are ready to cross boundaries and get into all these interventions, then good health automatically comes. We truly stand for the health of the community. The only thing is, unlike many other doctors, we do not see health differently from all these other things. Our vision was slightly different, and we felt that if we restrict ourselves to hospital and community health, then the health will come up to a certain level, but it will not go beyond that. As a model, Tribal Health Initiative is trying to tell the world that doctors can also be farmers or entrepreneurs in livelihoods. So all these are also very necessary. In the early times, there was many very difficult situations. We had one person who'd come in with a snake bite, and so when he came in, we gave him anti-snake venom, and he went back after 2 or 3 days. Well, but a week later, he came back with renal failure, and renal failure is something this we could not treat at that time, and it needed dialysis. We didn't need much; it maybe a 2 or 3 dialysis, and he would have got well. But he'd have to go to the city, which was about 120 kilometers away, where dialysis had. And the cost of a dialysis was 1,500. He could not afford it, and we were too poor to subsidize that and try to go into it. And he died because we could not save. Then I sat back and thought many of my friends were going to restaurants and eating for 1,500 rupees and not batting an eyelid, where here I am losing a life because I did not have the 1,000 rupees. There's nothing you can do but sit down and cry, and that's all we am. It is great because there have been people have asked me what is your greatest achievement, and I tell it is a team we have built from the local community and who are now poised to take leadership roles and are already taking leadership roles in taking primary initiative forward. So I feel very happy. I mean, it's a very satisfying past. I do not know what they would say to me. Trailers normally do not say, they show through actions. Suppose you do something for a person, they will not tell you, thank you, no formalities. But they will always stand with you when they are in trouble or when the institution is in trouble. And this we have seen over the years.